infertility, we also consider this as an apraja yoni vapat, where the woman or the patients who have never conceived in her lifetime is coming to a secondary infertility, where she'll be having one.
Dr. Swetha, 1 minute, and there was some error, and we will start again. So just now we were live. Dr. Swetha, are you able to hear me?
Yes, yes.
Yes. So we are live right now. Okay. So we will start now. Good evening, friends. So today again we are here in front of you because of some technical issues. Yesterday we were not able to be live, and we were not able to share our experiences or the views which we would like to share with all of you. So, but today we are again here in front of you, and we would like to extend our views related to fertility and how Ayurveda can help you all to get treated with the infertility, and to manage the infertility or fertility related issues. सो ये जो आज हम बात करेंगे, हम थोड़ा सा बाइलिंगुअल रखेंगे इसको, हिंदी और इंग्लिश दोनों में। बीच में बहुत सारी ऑडियंस ऐसे भी होगी, हमारे व्यूअर्स ऐसे भी हैं जो कर्नाटक से हैं या और भिन्न भिन्न अंगों से हैं देश के। तो उन दोनों को ही देखते हुए हम इस सेशन को बाइलिंगुअल रखेंगे, जिससे सभी समझ पाएँ। तो आज हम बात करेंगे इनफर्टिलिटी पे कि आयुर्वेद के ज़रिए हम कैसे फर्टिलिटी रिलेटेड इश्यूज़ को और इनफर्टिलिटी को मैनेज कर सकते हैं, कैसे उसे ट्रीट कर सकते हैं और कैसे ध्यान रखा जा सकता है। इन्हीं बातों पे आज हम बार-बार बात करेंगे और आगे समझेंगे कि कैसे कौन-कौन से ऐसे कारण हैं जो इनफर्टिलिटी पैदा करते हैं, इनफर्टिलिटी के कारण हो सकते हैं, और कैसे उन सभी को हम मैनेज कर सकते हैं। तो इनफर्टिलिटी के ऐसे बहुत सारे रीजंस हैं, जैसा हमने पिछले सेशन में भी बात करी थी। तो पिछले सेशन में डॉक्टर रिनी भारद्वाज हमारे साथ थी, और उन्होंने हमारे को बहुत सारे ही चीज़ों पे बात करी थी, बताया भी था कि कौन से ऐसे कारण हो सकते हैं। स्मोकिंग कारण है, हमारा लाइफस्टाइल कारण है, ड्रिंकिंग एक कारण है। ऐसे बहुत सारे देयर आर मल्टीपल रीजन, मल्टीपल फैक्टर्स विच वुड बी रिस्पॉन्सिबल फॉर द इनफर्टिलिटी, लाइक दैट ऑफ स्मोकिंग, अल्कोहल एंड योर लाइफस्टाइल, द फूड हैबिट्स विच वी inculcate in our lifestyle. These all are the factors. A very important factor which we have mentioned here in the last session, that was a stress, that how the stress will lead to the infertility and why it is very much necessary to manage the stress. So, taking in consideration of all these factors, we would be discussing the factors related to the fertility of a human being and the factors which would be uh, very much essential to be taken care of to manage the fertility health of a person. So here at Ayu Fertility and Nirmal Ayurved, we would be aiming that there should not be even a single person who is infertile. Everyone should be fertile, and everyone should not face the fertility related issues in their lifestyle or in their life circle. The fertility related issues is being a major concern these days. Everyone have seen ads coming on the television or on the website or on the internet, everywhere, that this fertility clinic, why we have so much of fertility clinics, why we are facing this fertility related issues or fertility related problems in each and every city of India. It's not about just India, it's not about just Bharat, it's about the global pandemic situation currently. And it has been estimated that if it continues in the same way, then the time will come when this infertility will become a pandemic, this problem will become a pandemic, the fertility issues will become a pandemic, and it will lead to a pandemic situation all over the world. So, considering the same, we are targeting with the help of Nirmal Ayurved and Ayu Fertility. Ayu Fertility is specialized branch of Nirmal Ayurved and a branch of Ayurveda, I can say, which specifically deals with the fertility and related issues in the current population. We aim here to give you more knowledge related to the fertility, how we can prevent fertility related issues in a person, what are the factors which will lead to these fertility related issues, what are the factors which will create lead to ultimately infertility, and how we can avoid those factors, how we can avoid those conditions to remain a healthy, to maintain a healthy fertile age, fertile life. Because Ayurveda says a person who is having multiple progeny, that is being resembled and that is being respected in the society. A person who is not having any progeny, that person is not being respected in the society. So, considering the same, we are here in front of you, and we will try to come in front of you again and again to create awareness to let you know about the factors which are responsible for your bad health, for your bad fertile health. Today we have Dr. Swetha Naik with us. She is a renowned fertility specialist in Karnataka. She's assistant professor in Department of Gynecology, or we call in Ayurveda as Department of Prasuti Tantra and Stri Roga, in Ashwini Ayurvedic Medical College, Tumkur. She is also practicing Ayurvedic infertility treatment for female disorders since last 10 years, and she have successfully managed many fertility cases in her career till now, and hope she will be managing all the infertility cases and patients who are facing the fertility related issues in the future as well, and very successfully. She have also done very great works in the field of fertility. Many of the patients who have 3 or 4 cycles of IVF and still they didn't succeed, those cases are also there in which Dr. Shweta have received achievements, and patients were able to get their progeny or get their kids. Ultimately, they conceived and they are happy parents currently. I have also personally seen the same kind of improvements with the help of Ayurveda in the cases who were undergone many a times fertility treatments, IVF treatments, 3 or 4 cycles of IVF. They have invested approximately 10 to 15 to 20 lakhs in their treatment, but yet no result. But after treating with Ayurveda, after treating with the principles of Ayurveda, they have received good results, and they are happy parents now. And moreover, I also like to add on here that the treatment of Ayurveda for this fertility is not expensive at all. It is very simple treatment, very much cost effective, and with promising results. So I request you all to please consider Ayurveda first. Whenever you are getting any fertility related issues, consider first Ayurveda, and it will combine both the treatments. We have also seen the same thing, that when we have combined both the treatments, at that time we have received maximum results. So this is our urge, this is our request to all of you, that please consider the Ayurvedic treatment first, because it should not be the time that at the time when you reach Ayurvedic treatment, you are on the verge and we would not be able to help you out. But yes, definitely in the initial days, we would be able to help you out, and it would be very much helpful for everyone. So with the same thing, I would like further to continue to enlighten us. I would like to invite our today's speaker, Dr. Swetha Naik. So, Dr. Swetha Naik, please be our guest and guide us further, enlighten us further. Thank you.
Good evening, one and all. Myself, Dr. Swetha. So I'll be your guide, or I can share my session, or I can share a few points regarding this treatment of infertility with consent to the Ayurveda. So I welcome you all for this session. Coming to this, so Ayurvedic, usually infertility is not a disorder. Usually we consider infertility the only the causative factors for the infertile woman. So it is not a disease. So single line of treatment cannot be implied to the infertility. It is only based on the causative factors, whether it may be Artavadushti or it may be Yoni Vapats. Based on that, we will be dealing with the infertile woman. So we have to find out the causative factors, then we can treat the disease accordingly. So coming to the statement Vandhyaha Nirapatyaha Stri. So what do you mean by this? This is nothing but the a woman who is not having a progeny will be considered as an Vandhya. So according to modern, if you want to go, it is an infertility is a disease of the reproductive system defined by the failure to achieve a clinical pregnancy after 12 months or more of regular unprotected sexual intercourse. So even after trying for the one consecutive year of unprotected sexual intercourse, if the woman is unable to conceive, then we have to find out the causative factors which is interfering for the infertility to happen. So coming to our types, we have n number of types according to the infertility. We have according to coming to our line of treatment, like classical references, we have given n number of types of infertility, but I just want to be in brief. So first is the primary infertility, so which denotes the patients who have never conceived. So the parents or the couples who has never conceived or attained the pregnancy will be considered under primary infertility. Secondary infertility is the woman who has been successful in completing the one pregnancy, then followed by she'll not be unable to conceive. So such things will be considered under secondary infertility. So for the infertility, we have like a large number of causative factors interfering the infertile woman. But according to FIGO manual, we have listed out, or I have listed out only one particular causative factors which will be interfering in the infertility. First one is vaginal factor, that is bacterial vaginosis, uterine factor. It may be fibroids, tubal factors, tubal block, peritoneal factors like endometriosis, ovarian factors like PCOD, that is polycystic ovarian disorders, which is like very much hampering the condition of the woman nowadays when it comes to today's era. And also coital errors. Coital errors is also one of the important factors, which is again a causative factor for the infertility. Coming to cervical factors, there might be cervicitis. And coming to last point is unexplained infertility. It may be 10% of the cases where we cannot rule out the causative factors. Everything will be fine in case of the woman, but still the woman will be suffering with the infertility. So such category will be categorized under unexplained infertility. So again, coming to the HPO axis, that is hypothalamo pituitary ovarian axis. So HPO axis plays a very important role in infertility or regulating the woman's body, since from the menarche till the menopause. So all the system or all the organs will be stimulated by this HPO axis in the female body. So endocrine factors plays a very important role in release of the ovary, or release of the ovum, or which is again a release of the follicle stimulating hormone, or it may be luteinizing hormone or gonadotropic hormones. So which is a very necessary thing, which is helpful for the fertility. So in such cases, coming to endocrine factors, we have hypothyroidism, hyperthyroidism, again polycystic ovarian diseases, premature ovarian failure. So, and again last one is an ovulatory cycle. So ovulation will not be happening, that is release of the secondary oocyte will not be happening in the woman. In such cases comes under the HPO axis deformities. So before going to our line of treatment, so I just took up the treatment aspect of the infertility. So coming to this infertility, where I can say Ayurveda suggests the purification and also rejuvenation therapy 6 months prior for the couple to ensure optimal ovum and also sperm quality. So usually when the couple comes to us, so we usually find out the what is the root cause of the disorders where the couple is facing the infertility, and based on that we will evaluate the persons, or we will counsel the persons, counsel the patients according to the need of the patients. So Ayurveda gives great importance for the preparation. So it is not only for the infertile patient. So whoever is going to conceive in the normal or today's life, it should not be a accident. So it should be always a choice. So when it comes to the Ayurveda, we always give the more importance for the Shodhana therapy, and also we also guide the patient to go for the Shodhana before any kind of conception to attain a healthy progeny. So coming to this, we also have a statement, that is Sankshepathah Kriya Yoga Nidanam Parivarjana. So Nidana has to be ruled out in any kind of the disorders, even it may be infertility or maybe any kind of disorders. Nidana is the main causative factors will be resulting into any kind of diseases. So first we have to find out the Nidana, then we have to treat it accordingly. So Ayurveda suggests the parents to observe a pre-conceptional regimen, that is called as Vajikarna, so to obtain an healthy progeny. So I'm just telling the Shodhana therapy, or maybe whatever I'm just saying, it is not only limited to get an healthy progeny, even the complications related with the pregnancy during the entire life of the woman, since from the amenorrhea, that is from the LMP, last menstrual cycle, till EDD, if the woman or couples who has undergone the Shodhana will be coming out with a less complications during the time of pregnancy. So Shodhana is very important. So Shodhana, the cleansing procedure or the removing the toxic materials from the body, plays a very important role in case of infertility. So I stress more for the couples for the preconceptional care. Why? Because to attain an healthy progeny, and also to reduce the complications which is been very boom or which is been very much occurring during the today's life. Maybe it is a PIH, or it may be a diabetes in the pregnancy, or hypertension, or maybe hypothyroidism, or hyperemesis gravidum. So many kind of disorders will be hampering the pregnancy when it comes to today's life. So if we go for the preconceptional care, definitely it makes a very good outcome, that to reduce the rest complications and also to get a healthy progeny. So making the decision to have a child is momentous. So based on that, so preconceptional care, it is not only a right mode of conception, since from the pathya, like since from the pathya till the continuous journey towards like pregnancy, and also till the completion of the pregnancy, it plays a very important role. Pathya, why it is important? As an Ayurvedic practitioners, I follow more pathya rather than the any kind of other shamana aushadhi. So pathya is again a very important role, plays a very important role in reducing the complications, or reducing the diseases which is occurring during the time of this pregnancy, or maybe for the infertile woman. So Ayurveda is a holistic way of life that takes care of all the things, like maybe it is a physical, or it may be in a mental, or it may be in the spiritual. It changes your lifestyle since from the preconceptional care to till delivery. So that is where it is occupying a very important role. Ahara, usually I told pathya plays a very important role. Pathya is nothing but the ahara. It is like a key, critical key to successful conception. So pathya has to be followed. It should not be like avoid the junk foods, or everybody will be knowing like to avoid junk foods, or maybe other kind of like baked foods, or maybe processed foods, everything. So when it comes to preconceptional care, we guide the patients to have a particular pathya which is very much helpful, like protein rich diet, vitamin rich diet, or maybe it is a balanced diet for a easy conception, both for the couples. It is not only for the female, it is also for the male. So pathya is like very very important in case of preconceptional care. So poor nutrition and stress of today's culture, so stress and also poor nutrition is the main cause for the infertile woman. So I have come across many patients who has all no zero pathology, like everything is clear, still they are unable to conceive. Then when it was given the preconceptional care, definitely they were happy in getting a healthy progeny, and they are happy parents also. So balanced diet again, like plays a very important role. Water, regular intake of water. Folic acid deficiency, it is not only for the neural tube defects, it also helps in forming the endometrium bed. So the implantation has to be occurred, or implantation which is occurring will be in a very positive way, or implantation occurs in the correct time or correct schedule. So that also very very important. So vitamin, again iron, calcium. So the foods which will be or the pathya which is advised during the preconception care also will be resulting into the removing this causative factors, which is again making an impairment in the to cause the infertility. So coming to the Jivaniya drugs, you can see my slide. So all I have put is dadi, kshira, everything. So it is not like everything has to be consumed. But coming to today's generation, we usually avoid all this maybe milk, or maybe ghee, or maybe everything. So it is the Jivaniya dravyas. So coming to ahara, usually after the shodhana, what Ayurveda says is once the purification has to be done, that is shodhana has to be done for the couples, then followed by the Jivaniya dravyas, that maybe all this Jivaniya dravyas will be helping out in preventing the complications. So what happens is Rutu, Kshetra, Ambu, Bija, these are the causative factors, or these are the essential factors for the conception. So Rutu, again we consider it as an uterus. Kshetra, so Rutu is a season, like what particular time where the couple has to conceive, and Kshetra is the uterus, so uterine pathology, or the Ambu, that is the proper nutrition which is helping out for the conception to happen, and also Bija, that is the very good ovum, and also sperm which is helping out for the conception. The essential factors for the conception. These are the four essential factors. So coming to essential factors, you can go for the ambu, the nutrition supply, which is very much helpful for the conception to happens. In such cases, we usually give the Jivaniya Dravyas. That is, Jivaniya Dravyas is maybe if you want to understand in general, it is maybe milk or ghee or maybe avago. So all these are the important pathya which is usually advised in case of this infertility or preconceptional care, I just want to say. And coming to a treatment protocol, so Agni Deepana, I have mentioned the first point as an Agni Deepana. What is its role? So Sarve Roga Api Mandagni Karana. Everybody has seen. So if the Agni is not proper, then definitely it will be resulting into the many kind of disorders. I am not telling it is only limited to the infertility. There might be many other causative factors. I have already told you in the first statement. So infertility cannot be declared as a disease condition, and a single line of treatment cannot be implemented for the infertility. But here, Agni has to be improved. So if you want to give the Shodhana procedure, or if you want to understand the Shodhana, or if you want to give the Shodhana procedure for the couples, so you have to initiate the Agni. So Agni Deepana treatment I have included, Shodhana again, Shamana and Vatanulomana. So what is this Vata? So Apana Vata Vaigunya will also be resulting in causative of the infertility. So Vatanulomana Chikitsa. Vata is again coming to Ayurveda. So Vata is the one which will be resulting into the causation of this infertility. So Vatanulomana Dravyas also plays a very important role in removing this infertility. So Agni Deepika Dravyas, before going to Shodhana, we have Agni Tundivati or maybe Chitrakadivati or Shunti Jola. Anything can be considered. So we have to initiate the Agni before we guide the patient to this Shodhana procedures. So Agni enhancement by these kind of drugs is very much essential. And next is the Snehapana. We also tell this Snehapana. It is not only Snehapana. If you just want to understand, it is a medicated ghee or oil which will be made to drink for the patient. So just to enhance the condition or to remove the toxic material, this Snehapana plays a very important role. Next comes the Swedana. So Swedana is again it is also known as sweating procedure. So where the massage will be done to the person or the couples. So Shodhana plays a very important role. Like even in the cellular level, the Shodhana acts. So each cell will be involved in case of Shodhana. That is to remove the toxic material. So all these are the initiating factors for the Shodhana. First is the to enhance the Agni, then comes the Snehapana and then the Swedana. So the last coming stage of this Shodhana is we have to decide what Shodhana has to be given. So the same protocol has to be followed. It may be Vamana, it may be Virechana, maybe whatever the kind of Shodhana you are taking place. These are the initial protocols has to be followed. So Shodhana you can understand as Sarvataha Suvishuddhaya Stesham Karma Vidiyate. So Shodhana regulates and restores the normal physiological function. For example, many a times the couples will be in the stress, or it may be in the diseases where they will be suffering with the diseases, some kind of disorders, which they will be thinking about the disorders, or maybe stress factor, or maybe workload, everything. So they will be in a dilemma and they will not be able to conceive in a particular time. So what happens in case of Shodhana? It restores the normal physiological function. So all the normal physiological functions will be restored, and they will be definitely body will be helping out in getting a healthy progeny if the patient goes for the Shodhana procedure. We have n number of Shodhana procedures, like maybe it is a Vamana, or it may be Nasya, or it may be Virechana. So based on that, we'll be understanding whether we have to opt for the Vamana. So what happens? So as an Ayurvedic practitioner, or maybe as an Ayurvedic infertility expert, I can say I usually goes based on the dosha predominance. So if Vata dosha is involved, then we go for the Basti. If Kapha dosha is involved, then Vamana. So if it is a pitta, then I go for the virechana. Based on this, I'll be opting my this what kind of shodhana I'll be implementing. So what is this vamana? Everybody knows. As my students will also be seeing this session, so I have just made a description. Vitiated and also aggravated kapha dosha. So all these kapha doshas will be the main sthana is for the kapha is amashya. So all the doshas will be coming out from the different parts to the amashya. So from the amashya, the easiest route is the oral cavity. So from there we are giving the all these medications, just we are eliminating the doshas through the oral route. So that is called as vamana, so which also initiates the agni. So agni, I have already said you, agni has to be there properly, or else it leads to the many kind of disorders. So it improves the chance of fertility. So definitely in case of PCOD, everything where kaphavrita will be there, in such cases vamana plays a very important role. So results in removing all this doshas, I have already told you. So coming to virechana, which is again a pitta. When pitta dosha is predominant, then we have to opt for the virechana. So virechana again helps in removing all this doshas through the anal route. So if the all the vitiated doshas will be formed in the pakvashaya, from the pakvashaya all these doshas will be eliminated through the virechana. So coming to a basti again based on the anuvasan basti or maybe niruvasti, you have to plan according to the dosha predominance. Like vata dosha is influenced, then you have to opt for the basti line of treatment. So basti again eliminates the doshas from the body, which enhances the lifespan of the basti. Usually what happens in each and every cell, the basti will plays a very important role. So it helps in removing the toxic material in each cell of the body. So definitely it helps in improving the longevity of the person. So sthanika chikitsa, coming to, I have already said you, it might be a bacterial vaginosis, it might be a cervicitis, or it may be a pruritus in the vaginal region. So if it will be influenced by the lots of bacteria and also fungal infections which will be happening, in such cases we have a very good sthanika chikitsa. I perform more and more sthanika chikitsa when it comes to the gynecological disorders. So here we have a Yoni prakshalana. It is nothing but the medicated liquid will be made into a kashaya form and will be washing the or doot of the vaginal region will be done, so that all the bacteria, so yeast infections or maybe any kind of infections which is again resulting into the infertility will be removed out through this Yoni prakshalana. And coming to the Yoni Pichu, it is nothing but the, in case of any kind like atropic or maybe pruritus, vaginitis, everything. So in such cases, this Pichu definitely plays a very important role. A sterile medicated cotton swab dipped in a medicated oil, definitely it should be placed in the fornixes of the vagina, which will be again helping out in removing the or treating the condition and also improving the hygienic factors of the vulval region or vaginal orifices, etc. So Uttarabasti. So I was generally talking regarding all this Shodhana procedure, everything. It is the complete body Shodhana. Coming to Uttarabasti, it is only limited to the uterine cavity. So uterus will be very, very important, because Kshetra is like very important for the conception to happen. In such cases, the purification of the uterus has to be played. Usually what happens to, in case of all these tubal blocks or maybe anything, I usually perform Uttarabasti just to make it a clear and helps for the easy conception. So tubes are very much important for the conception to happen. So in such cases, any kind of tubal blocks, everything. So I usually practice this Uttarabasti. It has a very important role in case of preconceptional care also. It is a procedure where uterine involvement will be there. So any kind of tubal blocks or maybe any kind of deformities related to this uterine cavity, the Uttarabasti plays a very important role, and this will be practiced by the Ayurvedic practitioners only. So you can also consult the Ayurvedic practitioners in case of any kind of tubal blocks or maybe tubal related factors which will be influencing with the infertility. Definitely it has a very good role to it remove the imbalanced doshas and also regularize the functions of the uterus. So Nasya. So coming to my last point, Nasya plays a very important role. Why? Because it stimulates the hypothalamo-ovarian axis. So HPO axis plays a very important role in the conception or maybe in release of the gonadotropic hormones or maybe steroidal hormones or maybe FSH or maybe LHR, whatever it is. So to enhance the HPO axis, I practice the Nasya. Nasya is very, very important in removing the conditions where it is related with the hormonal imbalances. So how it is performed, everybody knows. As Ayurvedic practitioners, everybody will be following this Nasya Karma. So I usually practice Shatavari because it is a Jivaniya Dravyas and helpful for the conception to happen. So one of the causative factors was there in my causative factors, like whatever I have listed through FIGO. So in that it is the coital errors. So definitely conceptual days also will be very important. If you just go to the any kind of Ayurvedic practitioners who is very much versed, like well versed with the obstetrician and also gynecology, they usually give the days. Like days for the conception will be from 6 to 15 days after the menstrual cycle. If there is a irregular cycles also, definitely they will guide you regarding what is the conception period which is very much limited or very much apt for the conception to happen. So this plays a very important role. Now it comes to the garbhadharana samskara. So once the body shodhana, everything is already happened, so good nourishment plays a very important role. I have already listed the good pathyas. So again we have like I have listed out small, like some of the medications which will be helping out for the garbhadharana to happen. One is Shatavari. Definitely everybody will be knowing this regarding Shatavari. Ashwagandha, again a highly rejuvenating herb. So Amalaki, again, and it acts as a rasayana. So all these are the very good dravyas which will be helping out after the body shodhana is already happened. So then Garbhastapaka dravyas, we have a Brahmi, Mandukavarni, Shatavari, Guduchi, Amalaki, Katukarohini, Bala, everything. So based on the body shodhana, based on the conditions, based on the nidana, I'll be choosing out the drugs which will be enhancing for the fertility to happen. So next comes the what is the its significance. It helpful for the maintenance of the pregnancy, helps in prevention of the abortion. We also come across many kind of the patients who will be repeatedly going on for the abortion conditions. We also call this as an putragni yoni vapat. In such cases also this plays a very important role, like pre-conceptional care as well as the treatment what has to be given, so that also will be prevented through this garbhastapaka dravyas. Then comes the Baya Prayukta Aushadis. So usually in case of Basti everything, I usually perform Basti everything with the Falagrita or list of medications which has been told. Maybe it is a Balataila or maybe Shatapushpa Taila or whatever it is. So based on this only we will be treating out with the infertility if the Vata dosha is involved in case of infertility to happen. So next comes the Abhyantara Prayoga. So what is this Abhyantara Prayoga everything? So usually once the patient is relieved from all this Yoni vapats. So I have already said you, it is not a disease to give a single line of treatment to happen. So single line of treatment cannot be included in the infertility. It is nothing but we have to find out the root cause which is happening. Maybe Artava Dushti, maybe Yoni vapats, which will be influencing to cause the infertility. In such cases, this is being told. So if Pitta dosha is predominant, then I go for the Virechana, followed by Jivani Dravyas like Chandana, Ushira, Manjurita, followed by formulations which is very much hard for the conception to happen. Then Kapha is involved, then I take upon Trifala, Arabhata along with the moons. So if there is no kind of with the milk, so if there is no kind of deformity which has been influenced, I go for the Pumsavana. Pumsavana in the form of like giving the oral medications which will be helping out for the fertility to enhance. So these all are the usually medications which will be followed in case of infertility. And Grita, definitely I go for the Falagrita. I have seen very n number of patients who is taking Falagrita. Even the threshold capacity of the woman throughout the pregnancy, I give this Falagrita. Why? Because the threshold capacity during the time of vaginal delivery will also be increased in the patient who has completely taken up this Falagrita. And also the baby weight or the fetus weight will be very good, or the development of the fetus will be very nice in case of Falagrita if the patient is consuming throughout from the first day or of the conception, or maybe it is a pre-conceptional care till the delivery. So this plays a very important role. And Shamana Aushadis, I also follow many kind of Shamana Aushadis. This is a few medicines which is being note or given here. So Sukumara Kashaya, again it acts as an anti-inflammatory. Shatavari, definitely a Jivaniya Dravya. Kumari Asava, to regulate the any kind of deformities which will be influenced by Artava Dushti, or it may be with the Yoni Vapat. Again, if there is any kind of infectious diseases, I usually go for the Septilin. So definitely it acts as an anti-infectious medication. And if there is any kind of torch infections which will be influencing the infertility, then we go for the torchinin. All these are the ayurvedic medications which will be usually followed. So this has a very good result in treating the infertility. So next comes the so again, Jivaniya Dravyas I have listed out here. Maybe Lakshmana or maybe Kakoli, Kshira Kakoli. All these are the medications which will be followed after the Shodhana procedures, which will be given to the couples or maybe the woman to enhance her fertility rate. So conclusion. So I just want to say Vandhyatwa is not a disease. So I cannot state one line of treatment to the Vandhyatwa. It is like a huge thing to understand the topic. So many a times the patient comes to be even with all the kind of reports, everything. So all the reports will be normal. Still they are going for the infertility. In such cases I also advise the daiva vapashraya chikitsa. Definitely all this plays a very important role. So practice ayurveda. Don't go for the modern techniques like ERT, artificial reproductive system, or IVF, or maybe IUF, which is like very very expensive. And even the hormonal imbalances will be more because of the injections whatever they are giving during the time of the ERT. So go for the ayurveda, go for the shodhana, and get the healthy progeny, and also with the less complications which is happening to you and also your family. Because the fetus or the new child which is coming is an emotional bonding between the family. It is not only influenced by yourself or your husband or maybe whatever. It is completely the family will be happy, or they will be eagerly waiting for the family member to receive. So in such cases Ayurveda plays a very very important role. Do practice Ayurveda, go for the Ayurveda, and get treated in a better way, and have a healthy lifestyle throughout the year. Thank you.
Very, very, very enlightening session, Dr. Swetha. Thank you. Thanks a lot. I hope that the viewers who were in the stream right now, they have had a very brief and knowledgeable session today. So, as you rightly said, there are multiple things which we can practice. There are multiple medications which we have been practiced since long ages and which we can practice currently as well for the treatment of infertility or to handle the tackle fertility related issues. I don't like the word infertility because it is not like that patient is infertile. Just the thing is that the stage, the avastha, that is avastha vishes, that's a part of life, that's a stage of life which eventually will pass on. So saying the infertility word is bit weird for me. So I would like to quote fertility related issues because if it can be treated, that then it's not a disease, it's just we have to treat it, we have to manage. And definitely I would like to request all of my viewers that don't take any medication without consultation. This is a irony or dilemma, or what we can say, the bad effect of Ayurveda, that people consider Ayurveda as OTC, that they will take something from the market or something from the shops or medical shops and start consuming them. And later we'll say that Ayurveda won't give results, or Ayurveda give results very slowly. But it is not so. If the Ayurveda is being practiced, or if you are under the medical supervision and you are under Ayurvedic treatment, then you yourself will know the effect of Ayurveda, how much it is effective and how fast you will get the results. Even though the treatment procedures of whether you will say HRT, hormone replacement therapy, or addictive reproductive therapy, or guided reproduction therapy, or IVF, or IUI, in utero fertilization, or intrauterine insemination, all these things when you go for, these are very much expensive, and moreover they are similarly time consuming as well. Moreover, it will create a social burden, it will create a financial burden, it will create a psychological burden as well. So, and what I have personally experienced, if I'm not wrong, Dr. Shweta, you can also add on to this, that the stress, it plays a key role in the fertility related issues. That all these fertility related issues which we are dealing with on these days, if you'll say maximum issues are because due to the stress. Either it may be social, it may be psychological, it may be financial, it may be familial, it may be professional. Any kind of stress can be there. It's not like it's just familial. Definitely, when we face some issues related to fertility and people fail to conceive, then the family pressure, familial issues, familial stress increases day by day. That is one of the point, definitely. But I would like to add on to this that apart from the treatment, the family values and the social values and the thought process of the family helps a lot to the patient. If
Yes.
the family is supported and they understand the situation and they initiate the treatment, they support the person, that definitely this issue can be resolved at a very early stage, right?
Yes. Yes.
So this is the main concern of the society currently, and I would like to guide all of you. I would like to request all of you that if any person in your family or around is facing any issues related to the fertility, then that's not a stigma. It can be treated like any other disease. So if a person is having fever, though, we will treat just as like a fever. So similarly, this part of the body is also a body functioning organ. So if a person is having some issues related to fertility, it's not a stigma that this need to be treated, or why a person is infertile, why a person is facing a related issues related to fertility. This stigma has to be removed, and that stigma will get removed automatically once the family start understanding that it's just a normal body physiological disorder which is happening and which can be corrected very easily with the help of some medications which are available at your home, and to be taken care of your lifestyle. And ultimately, with the help of some medication properly guided under the medical supervision, definitely can help you out to remove all these things from your body, and you can have a healthy progeny. You can be a very happy parent, in fact. And during the process also, what we are dealing here, it's not the only fertility, right? We are dealing with the fertility related issues, and moreover, apart from that, as Dr. Shweta have mentioned in her explanation, that if you are taking Sukumar Falagrita regularly during the period of your conception as well, after the conception as well, once you are pregnant, after that also, if you are taking Falagrita regularly, so that helps to maintain the energy level, and it will ease out the delivery process. It will ease out the process of a natural delivery. You need not to go for the surgical process, surgical interventions, until unless these are those are very much needed at the time. So if you take care of your body properly, if you'll take the medication properly, if you'll be under the supervision properly, and if you'll follow the guidelines accordingly, definitely your process of pregnancy would be very, very easy. And ultimately, the end result, what we are planning for and what we are gathered here, what we are discussing for, is to get a healthy progeny, is to be a happy parent, and that happiness you can achieve very easily, and that would be ultimate happiness to you. And with this, Dr. Shweta, there were few doubts of how to do this Uttar Basti. Like last time also we have discussed this, that Uttar Basti is indicated in all the persons, or there are some special indication. Is it like that every patient who is having fertility related issues, we can go for the Uttar Basti, or to some particular patients only we can do Uttar Basti? Like what I have experienced in my male patients, we do Uttar Basti, but there is a certain criteria to do that. So similarly, I have discussion with all the other doctors related to Uttar Basti. So what is your views on that? That how we can instill the Uttar Basti, or is it like for every person we can do the Uttar Basti, or it is limited? Yeah.
So it is like we have to understand, like I have already mentioned during the Uttarabasti, everything. So if there is any kind of tubal blocks, so tubal related factors where it is influencing with the infertility, so in such cases, usually we follow this Uttarabasti, everything. Need not to practice for everyone. If there is any kind of deformities which is related to the uterine tubes, then only we follow this Uttarabasti. And in case of like long term after shodhana, like the patient is suffering from since years, like maybe 10 years or maybe 11 years or maybe 12 years, in such cases also I have done this shodhana followed by Uttarabasti. Then they are like very much happy with the parenthood also. They have conceived and they have delivered normally vaginally, and they are happy parents also. So based on the criteria which is involved with the particular factors, then only this Uttarabasti will be indicated. It is not for all the individual. It is like a Sthanika Chikitsa. So, how we do Sthanika Chikitsa, everything. So, for the Uttarabasti, if there is any related issues which is happening with the tubal factors, or it is like a very delayed implantation or maybe anything. So, in such time, we usually follow this Uttarabasti. It is not for mandatory for every patient.
Sorry. At what point, the next question was, at what point a patient should feel like a person who are trying to conceive, who are trying to be a parent, and they're not able to conceive. So, what would be the timeline that at this point they need to consult to a doctor? Now, this is the time that they need not to delay it further. So, what would be the time frame for the same?
So I have already mentioned infertility is the thing where 1 year of consecutive try or unprotected sexual intercourse, even then the both the couples who are unable to conceive, then definitely they have to consult. It is not like 1 month of marital life, 2 months of marital life, or 6 months of marital life. Then they are coming to doctors, rushing towards the doctor. Okay, I am not able to conceive. It's not so. You have to wait for the 1 year of complete unprotected sexual intercourse, and then you have to consult based on the pathology, like what is the involvement of the causative factors for the infertility. Then we will treat it accordingly. So 1 year is the time duration. You can wait for the 1 year. Then if you are not unable to conceive, then definitely you have to approach your doctor.
Moreover, Dr. Shweta, what should be the daily regime or daily hygiene maintenance that a couple should follow?
So
Uh,
I usually tell dinacharya everything. So based on that dinacharya everything, if they are following the dinacharya, rutucharya, whatever is being told according to Ayurveda, definitely it will be like add upon to your conception. So dinacharya, rutucharya will be like a very important thing for the fertility to enhance.
Okay, so that's a very nice and informative session, Dr. Shweta, and I would like to thank you again, once again, for the information that you have provided to us and to our viewers as well. So, at this point, I would like to request all our viewers that please, whenever you are taking any medication related to any issues, whichever it would be, either Ayurveda or allopathy or homeopathy or Siddha, whatever medication if you are taking, please do take the medication under the supervision of a medical practitioner, and that to a specialist of that particular field. It's not like if you are taking Ayurvedic treatment, that should be given by a Ayurvedic practitioner only, because that person, that doctor, Vaidya only knows that how it has to be taken and how it will act in your body. For example, a very common medicines are available on market, which everyone can take, everyone will take, and they'll start consuming it. So I would like to mention here specifically every medicine, each and every medicine have its own effects and side effects. That must be known. So don't take any medicine. Likewise, don't take any medicine of your own. Whatever medicine you are taking, take it under the medical supervision only. If you are getting any symptoms, any problems, please make it that if Ayurveda can definitely help you, but in delayed ages, like for example, if you are suffering from any disease and you will come to the Ayurvedic doctor after 2 years or 3 years or 4 years of the disease, then it will become difficult for us as well to treat you. And when a patient comes with a hope, then we also have the hope, we also struggles to treat you. So don't come at last, make Ayurveda your priority, and you will notice the change in your life. Yeah, definitely everyone have its own importance. When a person is having any sort of infectious disorder, that has to manage with the help of antibiotics, because that infection, if it spreads, then definitely it will lead to some complications. But if you are having non-infectious disorders, try to consult with the Ayurvedic doctors at first. Definitely they will help you out. In case if it is not so, they will directly let you know, and you would be needing the higher care. But definitely try, don't come to the Ayurveda at last, try to come Ayurveda at first. When you will make Ayurveda your first line of treatment, definitely there would be a change in the society. Similarly, our Prime Minister have also mentioned the same, and for the same they are promoting Ayush, the Ayurveda system of medicine, integrated system of medicines. And once this comes in the practice, definitely it will benefit all of us. So with this, I would like to rest our session today, And once again, I'll thank Dr. Swetha Naik for being with us today. And we would be coming live regularly every Saturday, 4 p.m., with related issues, with the related things to fertility and how you can improve your fertility health, fertility lifestyles. So, considering the same, I will take a leave today. Thank you, one and all.